It makes more sense to ration care by need than whether you are wealthy or not. I don't think it makes sense to say that this person is wealthy so they deserve care over this other person who can't afford it.
Which side are you on? Which side are you on?
We also got an email, which I appreciate, and it was a long email, and you know, fellow presumably put some thought into this. Paul Ray sent in an email to us, and you can as well at tvlr.fm/contact. He said, you said this morning that you just feel the government could better manage health care for all as opposed to each individual union contract, and I would stand by that. And then you and your guests go on to lament how Medicare keeps getting worse. I did say that, and I also said that individual union contract healthcare keeps getting worse. For healthcare for everybody's getting worse, whether you're on Medicare or whether you're not. And so you ask, which is it? And I say it's both. Medicare is getting worse. Private healthcare is getting worse. And I think the government could better manage it as opposed to each individual union contract. The government can do better or they can't. And I think that they can, but it's also true that both the government and the private sector are doing worse as it relates to the past. And I believe that they can do better because in the past they used to do better.
Yeah, and I wanted to build off that because I think it's a rational point that he's making.
It is, yeah.
I understand where you're coming from on there, and I get that. And I think David's comment sort of spoke to that skepticism as well a little bit. I get that, but public schools is another great example of that. Our public schools have issues.
Right.
And as much as I am an advocate for public education, I am probably more aware of some of those issues than the average person, and am quite critical of public education systems and certainly its leadership. That said, I recognize that the public system, for its flaws and warts, is going to be and always will be superior to a privatized system, a privatized alternative. Because at least ostensibly, it is for the public, belonging to the public, and meant to serve the public, which I think to some degree gives us a better chance that that actually happens, right? As opposed to it not even being part of the mission and part of the foundation. So I get the skepticism there. I think it's not as if, if we achieve Medicare for all or a single payer system that, suddenly the fight's over and we don't have anything to worry about anymore, because I think at that point it shifts to constantly holding everyone accountable and constantly improving and tweaking the system. And you've seen this again, we're the outlier globally, right? Virtually every other well-off country on planet Earth has some form of single-payer health system and some form of guaranteed health care. And they've had fights over the years. The right-wingers in those countries constantly try to privatize it more.
Right.
The leftists in those countries constantly try to beat back those concessions. And the neoliberals somewhere in between are always, in between, often catering to the right. So that's happening in Canada and France and the UK and Australia, all over the world. Not a single one of them has ever gone backwards, though. You can't find a working class in any of these countries that would look at their system and the American system and say, let's go follow what the Americans are doing.
So what Paul tries to do is he tries to get to what he considers the root of the problem, and he says it's the insurance as an idea. Healthcare costs are too high because we've gone to a third-party payer system that separates the provider from the consumer. When an insurance premium is paid, it's like an all-you-can-eat buffet. People try to get as many services for their premium dollar as possible, causing an overuse of healthcare services by the consumer, and the provider inflates prices. And I've heard this, like on, arguments against single payer, but I don't know if you can
extrapolate these economics 101 types concepts strictly to healthcare.
Yeah, because who's
over-consuming healthcare? What does that look like?
What does that look like? Who are you talking to? Because you presumably have an insurance premium. Are you going and asking for extra heart surgeries? Because what does that even look like? Who are these people that's getting extra health care? What does that mean? Is it real? My contention is no.
Right. I mean, and
I have
think
never-
it's distinct from the fraudulent overbilling, the
Right.
warrant, the like. We all know about doctors' offices and hospitals that are, making you pay for these crazy tests that you probably don't really need. That sort of thing. I can recognize that.
But that's not on the consumer end. That's
but
on
that's-
that's the capitalist profit incentive on the part of the company.
Yeah, it's just more evidence of the ways in which profit motive involved in our health system is detrimental.
Yeah.
So to me, there should be no middleman. The health insurance industry has no right to exist. That's my opinion. I don't see. I just don't see why there needs to be someone, some entity
Right.
in between me and a healthcare provider. It just doesn't make sense to me.
Back to his email. Problem with the Medicare for All system is that it has the same problems, only shifted to government bureaucracy, a recipe for higher costs and limited care. And actually, this is something that does frustrate me because you can actually just look and see, these. There's a question there.
What's more bloated,
Yeah.
Aetna Insurance or Medicare? Come
Right.
on now, let's be real about.
You can just look that Medicare has 2% administrative costs. All these other companies have 10 to 20% administrative costs. So what's actually the higher costs? It's not Medicare. And also, is it a recipe for higher costs? Well, actually, why don't let's look at other countries who have similar things like Canada, like the UK, and you can actually see that they spend less on their health care
while getting better
better
results.
Better outcomes, and more people are covered.
Turns out when you don't spend billions of dollars on TV commercials and CEO pay and all the other waste that is in our current system, that's more money available to, I don't know, treat sick people.
Yes.
Put cast on broken legs. Give cancer patients the treatment that they need. That's what the priority should be. The thing is with the unions, this came up a little bit in our conversation earlier, and I wanted to piggyback off a comment William made in the chat about there is some element of opposition among some unions to single payer because either they currently have good health care in their contract and they fear it getting worse, or they feel they don't need it, or what William pointed out is some people will say, well, if health care is taken care of by the government, then what's the union gonna do?
Right.
Why
And
belong
it's
to the
like,
union?
well, you could do a lot of other stuff.
In fact, I would argue
You could do more.
I would argue this would be one of the best things to ever happen to labor unions in the United States if we got a single-payer health care, because so much time and energy and resources is eaten up fighting over the scraps of health care.
Right.
And if that was taken care of for all folks, and we all had a good foundation, regardless of where we worked or whether we worked at all, I think that would just be such a game changer. The unions could focus on pay, retirement, working conditions, management rights, the other issues that are often getting left behind because healthcare is such a leverage point that the employer has over us. How many people are stuck in bad jobs that they don't want to be at because they need the healthcare? How many people are stuck in crappy marriages?
How many people vote no on a strike because they know that their health care will get cut off?
Right. There are people who literally cannot go without health care or they will die pretty quickly. Right. And I'm not in that situation. I feel blessed that I'm not in that situation. But there are people who are, and we should take that leverage away from the employer. If we really believe that we have a life to liberty and life and pursuit of happiness, like if we really believe that, that entails being able to go to the doctor.
Yeah, you would think. The last thing that he says is the root of the problem is quite simple. You want somebody else to pay for your health care. With that attitude and approach, we'll always have higher prices, and if you shift to the government, you'll get rationed health care.
We already are rationed health care according to your ability to pay.
Yeah, that's exactly right. Like there is,
And hell, even if you have insurance, you still may be,
Right.
dealing with all kinds of complications
Yeah.
to just actually get the care you're supposed to get.
I have put off going to the hospital because I didn't want to pay the deductible, right? And I'm in a position where I could pay the deductible. I was just, I'm kind of stingy. And fortunately,
Right.
like Adam, my health conditions are not so bad that generally I'm a pretty healthy person. You've got that, invincibility complex as a young person. But, but
If anything, health services are being underconsumed in this country because there are tens of millions of people who are skipping medications, who are skipping doctor's appointments, who are not going to the hospital or doctor when they probably should for that very reason, because they can't afford it.
yeah, you're always, because of the fact that there's not infinite resources. To a certain extent, to a large extent, I think that it's really just do we have the political will to do the thing? And I think that, if we had the political will, everybody could get all the health care that they needed. And I don't think that there necessarily need to be any or much at all rationing. But generally speaking, you're going to have some amount of rationing in any context, and that includes health care. And the question is, how are you going to ration it? In America, we have rationed it by ability to pay. And in other countries, in the UK and Canada, they have rationed it by need of care. And I think that makes more sense. It makes more sense to ration care by need than by whether you are wealthy or not. Because I just don't think that makes sense. I don't think it makes sense to say that this person is wealthy, so they deserve care over this other person who can't afford it. I don't think that makes sense.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.